Do you know, have you heard of this word called chronic diseases?
Yes.
So when the chronic diseases come in your mind, what do you think? What is it? What's the common one?
Chronic disease is a disease which is it's a long-term disease, and it's not like that you get it right away, like common cold, flu. It's chronic means that it is there for a long time, and
Mhm.
it's progressing with your age and time.
Exactly. Very good. And is there a cure?
I guess there is a cure, but that is also not like having one Tylenol and Advil and it works in like 2, 3 hours. The cure is also little slow, and step by step you have to build up something against this chronic disease in your system, and then it's a slow acting treatment or process, in simple words,
Okay.
as far as my understanding is.
Thank you, Ram, for sharing this. So I'm just going to, kind of reiterate the facts. So yes, the chronic disease is something that long. We usually put a mark of 6 months into it. So the common in all chronic diseases like diabetes, high blood pressure, heart disease, heart failure, depression, asthma, COPD, arthritis, whatever we have, the commonality in between all of these things, actually, there's no cure. I mean, they can be managed, but there's no cure. That means whatever you do in order to make them better, you need to keep doing it, because once you stop it, it will come back. Just like diabetes, if you take your medications, your insulin, your sugars will be stable, but as soon as you stop some of these things, they will come back. As compared to other diseases where there's a cure, like, as you said, you have cough, flu, you take an antibiotic, you take Tylenol and stuff, and then that thing is gone. So we're talking about gone. These things, unfortunately, chronic things, they cannot be done. So we know they're very complex. There's not one cause to it. They're not like infective cause. There's no injury cause. There's complex cause. Sometimes they're good, sometimes they're bad, and they do get worse over time, and they have some complications attached with it. The key thing in managing all these chronic diseases is that it does need a big chunk of patient education, where the patient is self-monitoring, self-managing. There's a lot of behavioral things, but the key thing is that regular follow-ups. So all of these diseases that I have mentioned, think obesity like that. So obesity is an illness. Obesity is a chronic disease. Now you have also experienced that some years are good years and some years are bad years. Whenever you do a treatment for your weight issue, either it can be a keto diet or juice diet or 3-day fasting diet or intermittent diet, you do get results. But what happens if you stop it? Everyone has
You go
experienced.
back. You go
Exactly.
back.
Exactly.
Mhm.
So there is no cure. So so now all of the health in bigger organization, they're considering obesity as a chronic illness. So it's not a number game anymore. The current definitions totally changed. Previously we used to give a number, but now it's not about numbers. Okay, so it is how this disease is impacting you.